Give me a minute.
Yeah, we are live, ma'am.
Good afternoon, everyone. Hello, I'm Dr. M. Madhavi, consultant obstetrician gynecologist and infertility specialist and laparoscopic surgeon at KIMS, Cuddles, Secunderabad. Today, I felt I should be sharing some of my experiences which I have come across with some of the patients coming up at most of the common age is 35 years of her age, where I have seen that women's health is many a times not taken care. That could be because of many reasons. That if she's married, completed her family life, she's busy with her care towards the family and pursuing her career goals, and that's how she misses out on her important care of her health. Or if she's a homemaker, again she gets too much engrossed in her family life, taking care of her children, home front, and taking care of her family, where many of the things are missed out. Once I was just in a regular OPD, a woman comes to me and says, at 35 years of age, Madam, what is it? What is it that now I need to do? She was apparently healthy, but what she presumed, she is apparently healthy, but it was something to my mind. Yes, that's a really good. I was very much amazed to see her interest towards taking care of her health. And that's how this topic came to my mind, and that's how I conceived this idea of screen tests during 35 years age and beyond. Now, most of the time, the ladies, they might be homemakers or they might be professionals or working. In that case, if they have not had children, then simple thing during the pregnancies, if they have had blood pressures or gestational hypertension, what we call as pregnancy induced hypertension, gestational diabetes. So they lose out on the follow up checkups. So let us see what the screening in examination, we have divided it into examination, some tests, and the preventive measures. So, what is the examination? First thing comes to our mind is the weight. Let us see if she falls in the BMI. Weight is a very, very important marker for a woman's health, which is also important if she falls within the normal BMI. Is she obese or she's above the BMI or getting into obese or very obese index? In that case, obesity is a very strong marker for towards the risk assessment in many of the diseases like uterine cancers, cervical cancers, and breast, ovarian. These are some of the markers for the malignancies. At the same time, before that, they are heading towards the metabolic diseases. So weight is one of the most important because of their lifestyle modifications that they get so involved in their day-to-day activity. The work life home balance is just not there, and they lose out on the regular physical activity, dietary components. So all these things need to be taken care to maintain a very healthy weight. Next comes is your blood pressure monitoring. Women who have been identified as those having pregnancy-induced hypertension, what we call as preeclampsia, they need to have a proper follow-ups with maintaining the normal blood pressures. So they need to have a proper follow-ups and regularly visit the physician. There is another component of gestational diabetes, which is very, very common as inactivity has increased over years, and due to the food habits and processed foods, where we are more into packaged foods and not willing to have the freshly cooked food, they tend to, over years, they tend to start impacting our lifestyle. Then, in these cases, gestational diabetes and all, we need to have a proper follow up of the women after delivery, where we tend to lose to monitor our blood sugars, fasting blood sugars, post lunch blood sugars. So, a physician, we should ensure that the blood sugars during the follow up for the 6 weeks' time, it comes back to the normal. Now, other things which we are doing are the hypothyroidism. It is very commonly seen women having hypothyroidism. They are screened during pregnancy. That's a very good opportunity for us to screen during pregnancy. And those levels, the level of whatever levothyroxine she has been using, it reduces by 30%. Now, apart from this, we do come across the examination part. We examine, teach them to have the self-examination where the breast is examined with flat of the hand, fingers, and in a circular direction. So this self-examination will take you a long way where a woman is made aware about her normal structure of the breast. She should feel her texture, the texture of the breast, about the changes happening, and the size. Is she able to feel any sort of any mass? In those cases, if anything is felt, so these masses can be picked up, and you need to consult the doctor immediately. So self-examination definitely takes us a long way. And yes, as you come forward with the self-examination, when you're able to detect anything, the doctor may advise you to undergo some sort of ultrasound, and mammography has to be done. The new guideline says the mammography has to be done at 45 years of age, which was previously 40 years of age. Now, here, a very important thing is the family history. Family history, we need to know that is there any hereditary cancers out there, like breast carcinoma, the mother has suffered, or the aunt or siblings. So this helps us in the risk assessment of the lady in question, how many times and how annually we are going to screen her. We need to understand for screening, it is amongst the general healthy population. The female is not really having, this has to be done in the general population. These are all healthy women. Now, apart from the breast examination, we need to have a gynecological examination. Gynecological examination tells us about the uterus, ovary, cervix, and these are the structures which are examined during the gynecological pervaginal examination. Even a simple per speculum examination gives so much of the information. And accordingly, your doctor may advise you to go through any sort of pap smear. Pap smear is a test which is done to screen cervical cancers. Cervical cancers are very, very common in the Indian population, especially in the South Asian population. Cervical cancer is very common due to early age of marriage or in early starting of the sexual activity, multiple partners, all are the reasons for increase in the incidence of cervical cancers. Now, this is a very good thing that we have a vaccine, which we will come in the preventive measures. Now, apart from these examination, we have to also consider about the different tests. What are the different tests? We need to understand. Women over years, otherwise also women will have a lesser hemoglobin as compared to men. Why? That's because of the menstrual blood loss which she will be having during her periodic menstrual cycle. So, what a woman may consider as a normal, which might not be normal, that could be a little heavier than normal. So, this blood loss makes her anemic. And this anemia makes her adaptive, and this makes her continue, in spite of her anemic condition, she continues to do her house chores because there's no other option, and she continues with it. The other day, we were facing a woman whose hemoglobin has really dropped to almost about 2.6, 4.6. This is the common scenario which we are seeing nowadays. So, hemoglobin, or basically the complete blood picture, one test of this sort really gives us a lot of information. Apart from this, we have the anemia profile, and because of our way of cooking and consuming the food items, we are more prone to get anemia because many of the vegetarian diets may not be enough to give us the B12. So that is why we should be adding a lot of fresh fruits, vegetables, and animal protein, egg, and food products. These are the common items which we should be taking to prevent anemia. Now, it is just not the blood picture. We also need to check with the stores, for which we have serum ferritin and total iron binding capacities. These are what included in the anemia profile. Blood sugars, yes, as a woman walks in, a simple blood sugar, a random blood sugar gives us so much of the information, as well as HbA1c, which tells us about the 3 months of the blood sugar, which has been controlled. Anything has to be below 6. If you are above 6, it's definitely a pre-diabetic condition. A pre-diabetic condition is something where it raises an alarm as to, yes, it's time that I need to change my lifestyle and make some dietary modifications so that I'm able to control the blood sugars. And apart from this, you have the liver function test, lipid profile. Lipid profile is very important in our today's lifestyle. The food which we consume with the more of sugary diet and the fast foods, yes, there is always a chance that the cholesterols are increased. So we need to do the fasting lipid profile, which tells us about what are the cholesterol levels in the body. Thyroid, yes, we need to do the TSH, a simple first visit TSH of free T3, T4, and a TSH. And TSH, the levels, it may vary from lab to lab, but yes, what we prefer is the TSH levels below 4.5 or below 5 is the euthyroid state. Yes, apart from this, we have to know about the liver function test and kidney function test. A simple test of serum creatinine and blood urea definitely gives us to know the functioning of the kidneys. And apart from this, if a non-invasive test as to ultrasound of the abdomen and the pelvis, that tells us about the liver, gallbladder, kidneys, uterus, ovaries, and the cervix, bladder. A transvaginal examination of this, a transvaginal pelvic ultrasound gives us so much of the information as to is there any sort of fibroids nowadays. There is so much of rise in the incidence of fibroids because the women are postponing their childbearing or avoiding pregnancies for quite a long time and delaying their pregnancies. And that is most common. And even if they want, they are just opting for one child or so, where they are exposed to more of the estrogen activity. And that is the reason there is a rise of fibroids. And maybe more women are opting and coming out to get the health care and the facilities which we have. And that is how the detection rate has gone up. Yes, of course, the ovarian tumors, not only in women around 35, we have seen incidents as early as 19 years age to 17 years. Of course, around 35 years onwards, you should be having an ultrasound abdomen and pelvic. That tells us so much about a non-invasive test can tell us so much about the uh, uh, organs of the pelvis. Then we have per speculum examination. Per speculum examination is direct visualization for which we do a pap smear. Pap smear is nothing, that's just the screening test involved to pick up any lesions in the cervix or cervical cancers. And this is to be done in all women around in Western countries. It is more often done after 35 years of age. But in India, we are not, we in the low resource setting setups, we do have at least once in lifetime, if they are exposed. On an average, the guideline says at least once in 3 years. With the family history, they have to be, they need to come for the follow-ups. Then we have the HPV testing, which picks up the DNA testing. There are different types of HPV viruses. These testing will pick up different types of viruses types, and that's how the follow-up can be continued. If you are being tested for any of the oncotypes, then you have to be under regular further follow-ups to continue with the DNA test. Now, apart from this, the breast examination, we go for ultrasound of breast. Even a simple ultrasound breast gives us so much of the information about the breast texture or any of the changes happening in the breast tissue around the nipples, and is there any lump, cyst, or any of the changes happening. Those are picked up. And for mammogram, we need to go beyond 45 years of age. We need to do the ultrasound of the mammogram associated with ultrasound. These are compiled where the specificity and sensitivity of the test really increases in multiples. Apart from this, yes, as aging happens, when we are reaching somewhere between 40 to 45, there are so many hormonal changes happening in the body. The women may have a period disturbances, the periods can become irregular, or apart from that, there might be scanty flow. So here is an alarm as to why her periods are getting lesser and less, and there is irregularity or there is disturbance in the menstrual pattern. We should consult the doctor. Apart from that, as the physical activity reduces, the weight increases, and this is one of the most important risk factor for the polycystic ovaries. It is seen in women who have had during their early days or during the 20s or around 30s, they have had the polycystic ovaries syndrome. That may start again resurfacing. So we need to make them understand that any change in the pattern, which is very, very important, you need to consider. The more important, many of the women we have seen that they tend to just get periods hardly thrice or twice in a year. Now, in that case, we are very much concerned. This is what we call as premature ovarian failure. That means your ovaries are not secreting that much of the hormone to keep working to get your regular periods. So that itself is a big alarm as to, yes, the woman might be going into premature ovarian failure. But what is the problem? Why we need to know what is going to, what are the problems related to this premature ovarian failure? Now, estrogen, which is secreted from the ovaries, that protects the heart, at the same time the bone, and it gives a lot of mental health. It has impact on the mental health. Now, as the number of cycles go down, Before 40, yes, definitely, she is at risk of fractures with even trivial injuries or a simple fall. So we should be very much aware about to improve her bone health, increase in the vitamin D, and at the same time encourage her to get into a regular physical activity, exercise, and a good nutritional diet. So this is very important. Now, there could be even abnormalities in the periods. Yes, if the periods are becoming quite heavy, prolonged, and the cycles are short, that again is a very, very important time which where you are required to consult the healthcare provider. And this could be one of the reasons for her becoming anemic. That could be made because of fibroids or could be just a hormone disturbance. The endometrium is undergoing so many hormonal changes. There could be endometrial hyperplasia, or what the doctor does during this time is she takes one endometrial biopsy and we do a microscopic study which picks up any of the hyperplasia or cell changes happening in the endometrium. And these are one of the very sensitive tests and to be picked up during the endometrial sampling. Other tests beyond 50-55 years of age, where woman is nowadays the age of menopause also has increased because might be because of the good accessibility of better nutrition and women are quite active nowadays. So that could be one of the reasons that there is late menopause. But again, if there is late menopause, we need to again evaluate what is the, is she having, her periods are heavy, prolonged, or she's passing some sort of clots or pain. These are the complaints which she may come up with. Apart from this, yes, uh, in postmenopausal women, where the periods have completely stopped, if a woman does not get her period for about a year or so, in that case, yes, that is what called as menopause. Now, in at the age of menopause, what we are concerned on, we need to do the routine blood pictures, thyroid, monitor the blood pressure, take the family history. Any hereditary cancers also we need to take into account. These are some of the important parameters which we need to consider. As you age, your body metabolism also slows down, and that is when we are more at risk of metabolic diseases. Now, what are the metabolic diseases like diabetes, hypertension, dyslipidemia or increase in the cholesterol? These are some of the reasons where we are very much concerned. Postmenopausal, here, the important thing is that we need to advise them for the bone mineral density. And bone mineral density is important to find out any sort she is prone for any sort of hip fractures or spine fractures. So this is what I feel that would have given you a lot of insight about the health, where women really lose track of their health. And I would like to add, ounce of prevention is always is a pound of cure. So I wish all women a very, very happy and healthy life. And I'm at KIMS Cuddles Secunderabad between 10 to 4. So for any queries, you can definitely and have a physical examination too. In physical, you can just come and meet me and consult and clear with your queries. Thank you so much. I'm here to clarify with some of your queries and questions if you have. So do come up. Feel free to share some of the questions with me. Yeah. There's a question, how often should women get tested? I feel tested is something, a very vague question, or you can make it for the blood test and all, you can make it as an annual. And for pap smear and all, once in once in 3 years, that is good enough. And a mammogram at 45 years, that is what we advise. How to prepare for pregnancy at 30 to 35 years? Yes, it's something like we give them regular folic acid to be taken before you plan for pregnancy. Get the baseline profiles as to the blood picture, thyroid, prolactin, all the other profiles like liver function, cholesterol, all these levels are done. And a basic pelvic examination or an ultrasound gives us a lot of information, and consult the doctor as to, yes, all the levels are normal, and then you can plan for pregnancy. Yeah, that's what. And pap smear once in 3 years, that should be fine for a woman over age of 40. There's a question as to, Doctor, my mother is 55 years old now, and what tests should she have, and what are the recommended lab tests at this age? Yeah, just a routine. First, we need to check her weight, blood pressure. Then we will run through some of the tests like blood picture, blood sugars, random blood sugar, fasting, post lunch, HbA1c, lipid profiles, liver function test, serum creatinines, blood urea, and apart from that, you have ultrasound of her whole abdomen, pelvis, and a mammogram of both her breasts. And added to that, if we do a bone mineral density of spine and hip, that would give her a complete test what she requires at that age.
Last. These are the questions done. Thank you.
Okay, I feel no more questions we have. Thank you so much for the patient hearing. Hope I have clarified. In case you want to meet me, I'm at KIMS Cuddles, Secunderabad. You can come and consult me there. Thank you so much.